Tell me about yourself.
I am a recent graduate from the College of DuPage Physical Therapist Assistant Program. Prior to College of DuPage, I do have a Bachelor's of Arts in Psychology from the University of Iowa. Prior to school, I was in a different setting for career. I was in retail for 15 years. Decided to do a career change, something that was more beneficial for myself and for my family, a little bit more fulfilling. So I went back to school to better myself to help others.
Tell me a little bit about your experience in the field.
Okay. Right now, I do have experience in a subacute skilled nursing facility. For that setting, I've dealt specifically with patients that have Parkinson's. We've done some joint replacements, specifically hip and total knee replacements. We've assessed for balance deficits, gait patterns, ambulation, wheelchair mobilities, bed mobilities, and even some ADLs for the patients in their rooms when they're getting ready for the day. And with that setting, I do have specific experience with Cassandra for documentation for the EMR system. And the next setting that I had was for an orthopedic outpatient scenario for clinical setting. And for that one, we had a lot of joint replacements, rehabbing total knees, total hips. There is some low back pain, ACL, meniscus tears, and planning and executing interventions for those patients to have skilled therapy. There was some IFC for electrical stimulation, for pain relief. And for that setting, I also had experience with Optimus for the EMR system. Prior to those settings, I do have 2 years of experience with another practice as a rehab aide and a patient services coordinator. So for that setting, I work a lot with the patients and helping the physical therapists and the physical therapist assistants at my clinic. Just assisting patients with exercises, leading interventions, applying modalities, specifically doing IFC. We've done some Russian, hot packs, cold packs, and other things like that. For my current setting, for my rehab job, they use Redoc as a documentation system. We use Cerner for scheduling, and I do have experience with Photo, which is for a functional assessment for patients for that setting.
Tell me about some of your strengths.
I believe I am a team player. I'm very dedicated. I am a quick learner and a very methodical thinker.
Okay, on the flip side, tell me about some of your weaknesses.
I am a perfectionist by nature. I've learned to not expect that from others always being around me. I'm learning to be more mindful with my communication, knowing others may interpret things differently than I do.
Tell me 5 words that describe you.
I would say genuine, compassionate, thoughtful, driven, and open-minded.
What would your coworkers say about you?
I believe in my prior retail leadership role, they would say that I was knowledgeable, caring. I always made a point to make sure that they were doing okay, how their day was going, if they ever needed anything from me. Motivational for the fact that I would always push them to be their best, encourage them to do what they could. Always asking for feedback or what I could help them with to get them to where they wanted to be goal-wise. And lastly, I would like to say that they would think I was fun. I like to keep it lighthearted. I always encouraged a fun team spirit and always wanted to be part of the fun and the action. We did lots of contests and just getting everybody excited.
What do you like working in a group or a team setting?
I tend to be a little bit more reserved, knowing that I'm more of a methodical thinker. I do listen to others, and I'm able to shift my thinking to kind of accommodate the task that we're trying to accomplish. If others don't step up right away, I tend to take the reins a little bit and start projects. I'll ask questions, I'll ask for feedback, engage to make sure that we're meeting goals and going for the expected outcomes, just to encourage participation.